body requires a minimum amount and a maximum amount of energy. So the total liquid, the total water you take in must be equals to the total water you will excrete in 24 hours for a normal human body functioning. So that is what we are also doing. The total food you take in should always be equal to the total food or the energy you are expending, or the expenditure of your energy. When you eat more than required, it causes so many damage. So the energy storage expenditure, the meal intake, which is also known as the surplus storage, which example of food or example of the way our body stores glucose are glycogen and triglycerols, must be equals to the energy expenditure in every 24 hours. So matching intake to expenditure prevents obesity and wasting. So when you are taking equal amounts of food, when you are taking equal amount of food, this is equals to the energy you are spending every day, it will prevent obesity. That is why exercise is always recommended by you. And to eat 2 times in a day is good, not 3. And to fast once in a week is also helpful for the body. Okay, we have for the first state, metabolic fuel storage, a consulting level analysis for professional audiences. So we have the glucose spec. So what happens when you eat? What happens when you eat? So let's use carbohydrates, which is so popular. So when you eat carbohydrates, so the byproduct of carbohydrates are simple sugars, and examples of simple sugars are glucose. So when you are eating, we call it the fed state, the process by which you are taking in organic substances. You are taking in food molecules, micronutrients. Examples are carbohydrates. When you keep on taking these carbohydrates, injecting inside your body, what will happen? It will lead to high level of glucose, because the byproduct of carbohydrates are simple sugars, and examples of simple sugars are blood glucose. So when this is very high, what will happen? An enzyme called insulin, is released. So this enzyme performs most times 3 functions. One is the glucose is taken to the liver. The second one is the glucose is taken to the muscle. And the third is it is esterified to fatty acid, then to triglycerol, and stored in the adipose tissue. So let's start with our first one. The glucose is taken to the liver. So why is glucose taken to the liver? So we have granules in the liver, in the hepatocytes. So what do? They help in storage of glucose. So when you eat too much carbohydrates, or when you eat during the feeding state, which you call the fed state, what is happening? The byproduct of that carbohydrate is glucose, and when that glucose comes, an enzyme called insulin is released, and whenever there is high level of glucose, we call it what? Hyperglycemia. Whenever there is high level of glucose, we call it hyperglycemia. And whenever glucose level is low, we call it what? Hypoglycemia. So glucose level is high, we call it what? Hyperglycemia. Glucose level is low, we call it what? Hypoglycemia.